Morning, Ms. Sparks. How are
Good
you?
morning. I'm well, thank you.
My name is Eli Metz. I'm a nurse practitioner student. I'm going to be performing an abdominal, a neurological, and a musculoskeletal assessment on you today, okay?
Okay.
All right, would you mind laying down flat on this table? And then what we'll do, are you comfortable with me taking your gown up?
Yes.
Right underneath your breast area, okay? Thank you very much. So we're going to begin with the abdominal assessment. The first thing I'm going to be looking for is just the general appearance of the skin, color, temperature. Seems to be a normal temperature. No moisture, no swelling, no obvious bruising, scars, lesions, or nevi. Okay, no evidence of any trauma. I'm going to be looking at the symmetry of the stomach and the abdominal area. I'm looking for any visible pulsations or peristalsis, of which I see none. Also a Cullen sign, which would be bruising around the umbilicus, and that appears to be negative as well. The next thing I'm going to do is I'm going to listen with a stethoscope on your stomach for bowel sounds in all four quadrants. Okay. After that, we're going to be auscultating with a stethoscope on your arteries in the stomach area and the abdominal area. I'm going to warm it up here, and first we're going to listen for the bowel sounds. Okay. Bowel sounds present in the left upper quadrant, right upper quadrant, right lower, and left lower immediately. Okay, very good. Now I'm going to be listening the abdominal aorta, okay? Here in the midline. I'm listening for any bruise, which would indicate turbulent blood flow. I'm going to move over here and listen to the renal arteries and the right renal artery. And then over here at the left. Okay. Move down and listening for the iliac arteries on the right. And the left. And then down here, I'm going to pull down on your shorts just a little bit and listen over the femoral artery area, okay? And then on the left side, okay? Okay. No bruise are able to be auscultated, okay? Okay, now I'm going to begin by percussing the four quadrants of your abdomen. I'm listening for just normal resonant tones. I'm trying to identify any abnormal tones, which would be a tympanic or a dull sound, okay? So I'm going to begin up here. Okay, and now I'm going to palpate to try to identify the liver edge, the margin of the liver, to estimate its size, and then also we'll be percussing over on this side to try to identify the border of the spleen, okay? So I'm going to start down here, the mid-clavicular line on your right side, moving out towards this costovertebral margin. You can hear the change of tone there as I approach the liver edge. Okay, I'm going to try to come up from the top and do the same thing. Okay, very good. Okay, and I'm going to reach over and do the same thing on your spleen, beginning somewhere on the anterior or the mid-axillary line over here, which should be well above the border of the upper border of the spleen. Change of tone to dull. Okay, very good. Okay, now I'm just going to lightly palpate in different areas of your abdomen here. Let me know if there's any tenderness. Okay. And a little deeper, okay. Okay, at this point, is that tender? Okay, all right. Now I'm just going to be feeling here for the liver edge again. Okay, and then again for the spleen. Should be able to palpate here the splenic tip of the upper portion of the spleen by pulling upwards, and I can there. Okay, very good. Now I'm going to do what's called a liver scratch test, where I'm actually going to place my stethoscope over where I estimate your liver to be based on the palpation and percussion we did earlier. And I'm going to be scratching so I can hear the difference in the tone as I approach the lower and the upper margin of the liver edge, okay? Very good. And then again from the top, I may have to pull your brow back slightly, just displace it, it's fine. Okay. And there we go, very good. It's like roughly about 6 to 7 centimeters, which would be normal, okay? Okay, now I'm gonna do a few tests to test for specific issues with either your gallbladder or your appendix or certain types of irritation, okay? The first one will be the Murphy sign. So what we're looking for here is gallbladder irritation or possibly infection. So I'm going to put my thumb here underneath the edge of your rib cage, and I want you to take a deep breath in. Okay, any pain there? Okay, now I'm going to hook 4 of my fingers. One more time, deep breath. Any pain? Okay. I'm going to do indirect fist percussion now, okay? On this side. Any more pain on one side versus the other? Okay. All right, the next thing we're gonna do is the psoas sign, and this would be for acute appendicitis or appendiceal irritation. So I want you to keep your right leg straight, but I want you to bring it up against resistance on my hand. Straight and up, okay? Any pain there?
No.
Okay, very good. Another test we can do for acute appendicitis would be the obturator muscle. So I'm gonna bring your leg up. I want you to turn your knee inward from me. I want you to internally rotate against resistance. Okay, any pain?
No.
Good? Okay. And then we did this earlier when we were palpating in the abdominal wall, but this is the rebound tenderness test. So this would be indicative of peritonitis or some other type of peritoneal irritation. So that's where I'm just gonna press in right here and let up. Any issue when I do that?
No.
Okay, on either side?
No.
Okay, very good, thank you.
You're welcome.
Okay, the next thing I'm going to be doing is just doing a general inspection of your joints, your muscles, your extremities. I'm going to be looking for any deformities, any swelling, any nodules, any areas where I can palpate crepitus under the skin, okay? And we'll be doing some more detailed examinations of these joints coming up, okay?
Okay.
Just raise this on up for me. Okay. While I'm doing this, I'm also going to be assessing your pulses. Okay. Radial pulses. 2. I'm going to look at your capillary refill. About 2 seconds there on that here. Okay. Radial pulse over here. So 2. Capillary refill on that side is also less than 3. Okay, I'm just going to be looking here at your knees. Okay, the ankles, bones of the feet. I'll be palpating the dorsalis pedis here. So 2. And then the posterior tibial pulse behind the medial malleolus here. A 2 as well. I would actually call the dorsalis pedis, after having compared the two, a 2+. A little more bounding than the posterior tibial on the right. And the same grading on the left. 2+ for the dorsalis pedis and a 2 for the posterior tibial. So no deformities, no warmth, no redness or swelling, no crepitus able to be palpated at any of the joints bilaterally. Also no nodules that are visible. Okay, now we're going to test the range of motion and strength in some of your upper and lower extremities. Okay. So the first thing I want you to do is touch your chin to your chest if you can. Okay. And then I want you to hyperextend this way. Okay. Very good. I want you to turn your head left, now left. Okay. And then I would like for you to, you already know what I was going to ask. I want you to lean it to one side of your right shoulder and then back to your left shoulder. Okay. Very good. Now, if you could turn this way for me. Okay. I'm going to look at the vertebral column now. I want you to first bend over slightly. Okay. And then come back towards me. No need to go quite that far. Okay. And then come backwards for me. I won't let you fall. Okay. Very good. I'd like for you to, hands staying on the hips, lean to the left side for me. Oh, that's your right, but to the right will be fine. Okay, and now back to the left. Okay, and then you can leave your hands on your hips if it's comfortable. I want you to turn. Okay, and then in the opposite direction. Okay, very good. Now, if you can, put your feet kind of together and put your hands straight out in front of you. I want you to bend over as if you were going down to touch your toes. Keep going, keep going. Okay. Stay right there for me for one moment. Okay, and this is where I'm looking for scoliosis, looking for that telltale rib humping, which you may have a little here on the left side, but certainly mild. Okay, you can stand back up if you choose. Okay, now we're going to move on and assess your shoulder joint. If you can, take your left arm and cross it across your chest like this. Okay, now with the right arm as well. Okay, and then what I'd like for you to do is take the left arm and go up as high as you can on the side like this. Okay, and with the right. Okay, very good. Now if you can, put your hands out in front of you like this. I'd like for you to cross the left over your chest. Okay, and then out. Very good. Same thing with the right. Okay, all right. Now, if you can, I'd like for you to take both arms and go up as high as you can, straight in front. Very good. Now if you can, kind of come back this way slightly, and then show me how far you can go that way. Okay, very good. Now, if you can stick your arms out to your side, I'd like for you to just make a circular motion. Okay. And then the last thing I want you to do is I want you to take the left hand, reach back here as if you were scratching the middle of your back.
Left hand.
Left. But you did it with the right too. Let's see with the right. Okay. And then the same thing if you had a scratch down low. Okay, and with the right hand. Okay, very good. All right, you can take a seat. Okay, now we're going to keep moving down the body and the arms. I want to look at your elbows next. If you can, just put your arms out in front of you. I'd like for you to flex them like this, okay, and then extend all the way out, straight, very good. Okay, now if you can, place your palms down, okay, and then up for me. Okay, very good. All right, now leaving your arms out straight like this, we're going to look at the joint of the wrist, okay. First, I'd like you to put your hands up like you're stopping traffic. Okay, and then back straight, and then if you can, flex downward. All right, very good. Okay, now I would like for you to do a little rotation if you can. Can you rotate that wrist? What about the left? Okay, very good. And the last thing I want you to do is keep those arms straight out for me, and let's take the whole hand and move outward, and then inward. Yes, very good. Okay. Now we're going to go down to the fingers, okay? What I'd like for you to do here is simply make a web like this with your fingers, okay? And then bring them back together. All right. Now, let's see. I'd like for you to make a fist, both hands. Okay. And then fan them out really wide like this. Yeah. Okay. Very good. And then if you can, kind of flex this thumb back for me. Okay. Finding that anatomical snuff box right there. Okay. Very good. Okay, next I'm going to look at the range of motion in your hip. Okay. So first thing I'd like for you to do is just pull this leg up and kind of bring your knee to your chest as much as possible. Okay. All right. Now, can you kind of favor this? Come this way towards me. Okay. And then I'd like for you to leave this leg straight out and kind of externally extend that joint. Okay. All right. Now I'm going to raise this up. Okay. Okay. And then I'm going to bend this at the knee. Okay. We're going to internally rotate and externally rotate. Okay. And we would at this time repeat these tests on the opposing side. Okay, now I'm going to ask you to straighten this leg out for me if you can, looking at the extension of the knee joint, and then back down to a bent position. Over here, straighten. Okay, very good. Now what I'd like for you to do is actually, can you lay back here, just like that? Yeah, I need your feet off of it. Okay, very good. Okay, now what I'd like for you to do is with both feet kind of point out, like point your, yeah, okay. And then pull them back to you like this, all right? And then I'm going to look at the inversion, eversion here of both ankles, okay? Okay, and then can you kind of rotate these joints? Yeah, your ankle joint for me. Any pain or discomfort?
No.
Okay, very good, thank you. Okay, the next thing we're going to do is some strength testing. First, we're going to start with your upper body or upper extremities, okay? So earlier, remember we did the chin to chest with your neck. I'd like for you to do that now against resistance, okay? I'd like for you to pull your head back against resistance as well, okay? Very good. Now, I'd like for you to do the outward motion here of your shoulders. Yes, just like this, okay? And then if you can, with this hand, cross across your chest here, and you do that against resistance, okay? Kind of keep your arms straight and do it here. Okay, very good. Okay, now with your arms straight in front of you, okay? I'd like for you to bend your arms at the elbows, pull them back to you, yep, okay? And then push against me here, okay, very good. Now, for the wrist, actually we're not doing the wrist. For the hands, I'm gonna cross my fingers here. I want you to grab my fingers and squeeze them, okay, for grip strength. Very good. Okay, now, while we're in this seated position, we're gonna do the knees, okay? I'd like for you to bring your legs straight against resistance, and then I want you to pull back. Okay, very good. All right, and then while we're in this position, we'll do the ankles as well. I'd like for you to point your toes, okay, like so, and then pull them back against my palms. Very good. And then if you could just assume the position of lying supine again. Okay, now all we're gonna do here is simply test the hip joints. Okay, I want you to push out against my hands using your hips, okay? And then push in. Okay, very good, thank you. Okay, now I'm gonna perform a test called the straight leg raise test, a test for neuropathic pain, okay? You can just relax. I'm gonna raise this leg, okay? I'm going to dorsiflex the foot. Do you feel any increase in pain or discomfort?
No.
Okay. I'm going to do it on the left side now. Again, any pain there?
No.
Okay, very good. Okay, now I'm going to perform two different tests on either knee for a fluid around the knee or any swelling, okay? First one is the elopement. Okay. I'll do the same thing on this side. Okay, and the second one's going to be called the bulge test. I'm going to put a little lateral pressure here. Okay, same thing on this side. Okay, and both those tests are negative. Okay, now I'm going to perform the McMurray test. This tests the lateral and the medial meniscus, okay? Kind of bend your leg or your knee to around 90 degrees. I'm going to turn it out. Maybe extend it here a couple times. Okay, I'm to turn it in, we're going to do the same thing. Okay, and then we'll repeat this test on the opposing leg. Okay, now I'm going to perform the varus and valgus test for stability of the medial and the lateral collateral ligament of the knee. Okay, so I'm going to grab here. Okay. Okay, and then I would do the same thing on the opposite leg. Now I'm going to perform an anterior and posterior drawer test, okay, to check for ACL and PCL stability, okay? Okay. Okay, as normal or expected finding. And now we'll do the same thing on the opposing leg. Okay, and kind of in the same vein as that, we're going to bend a little less of an angle this time. We're going to do the Lockman test, which is also for ACL stability, okay? Okay, very good, thank you. Okay, can you put both hands out like this for me? Okay, straight out. And tell me if you feel any numbness or tingling when I tap in this area. On the left, how about the right? Okay, next thing I'd like for you to do is bring your wrists together like this and hold your arms just like that. We're going to do it for about a minute or so, okay? Okay, after about a minute, any numbness or tingling that you noticed?
No.
Okay, very good. And then the last thing I'd like for you to do is put your hands out in front of you, grab your thumbs in this manner, and then actually extend the wrist down like this. Roll your wrist down. Okay. What about any pain, numbness, tingling in here?
No.
Okay, thank you. Okay, now I'm going to perform what's known as Sperling's test for cervical radiculopathy. Okay, I'm going to ask you to rotate your head this way. Okay, any pain there?
No.
Okay, what about when I press down?
No.
Okay, let's do the same thing on the other side, to the right. How about now?
No.
Okay, very good. Okay, next I'm going to perform two tests for a rotator cuff tear. First thing I'll have you do is bring your arms straight here. Let me support the weight, okay? And then when I let go, try to let them slowly go down to your side. Okay, very good. The next thing we're going to do is the empty can test. I want you to hold them about this angle, and I want you to rotate your hands down, okay? All right, and now when I push down, any pain there?
No.
Any shooting sensation? Okay, good. Hawkins test for subacromial impingement, okay? I want you to let me support the weight of your arm, okay? And then I want you to tell me if this causes any pain or discomfort. On that side, okay? Let's do the same thing over here. Again, let me support it. Okay, how about that? Okay, very good. Okay, now we're going to begin the neurological portion of the assessment. Based on our conversations throughout the previous portions, I can tell that your cognition is intact. You have an appropriate mood and affect, and you seem to have an intact judgment and memory. So we'll move on to the cranial nerve assessment, okay? Beginning with 2. So there's a chart over here on the wall. It's not a Snellen chart, but we can see that this smaller lettering here. What I'd like for you to do to test your visual acuity is tell me, can you read that line, this print?
Ligament damage. Yes.
Very good. Are you able to read this? There's a little too far.
Okay. Anatomical chart company.
Okay. Very good. Very good. So your visual acuity seems to be intact, okay? And then for peripheral vision, one of the things I want you to do is I want you to continue looking at a line on that chart, any line. I want you to tell me when you can see my fingers that are wiggling move into your peripheral vision, okay?
Now.
Okay. And what about over here?
Now.
Okay, very good. Okay, now for cranial nerves 3, 4, and 6, I'm going to take the tip of this pen or this pencil and I want you to follow it with your eyes, okay? This is going to test your extraocular movements, or what are known as the cardinal fields of gaze, okay? So start here, follow the tip. Back across. Okay, very good. Okay, the next thing we do is the trigeminal or the cranial nerve 5, okay? So what this is going to consist of is facial sensation. First, actually what I want you to do is I'm just going to clench your jaw here. Feel your TMJ. Okay, now what I want you to do in just a moment is close your eyes, but first, do you recognize this as a dull and then a sharp sensation?
Yes.
You can differentiate between those two? Okay. So I'd like for you to keep your eyes closed, okay? And then I want you to tell me each time I touch this pencil to your cheek, whether it's a dull or sharp sensation, okay?
Okay.
It'll be cheek, forehead, and then down around the jaw, okay? You ready?
Okay. Dull.
Okay.
Sharp.
Okay.
Dull. Sharp. Dull. Sharp.
Uh-huh.
Sharp.
Okay. All right, you can open your eyes. Okay, the next thing we're going to do is acoustic. So what I'm going to do is I'm going to rub opposite side as I whisper a combination of letters and numbers into your other ear, and I want you to repeat those to me, okay?
1x4.
Okay, we're going to do the same thing on this side.
C310.
Very good, very good. Okay, now we're going to do cranial nerve 9, which is the glossopharyngeal, and 10, which is the vagus nerve. So one of the things I want you to do first is just stick your tongue out to me and say ah.
Ah.
Again.
Ah.
Okay, I can see the uvula's symmetrical midline and the soft palate rather, and the uvula rises with phonation. And then I'm not going to test your gag reflex today, okay?
Thank you.
All right, and then we see the pharyngeal movement there. One of the things I forgot to do for cranial nerve 5, I want to do what's known as a corneal reflex, okay? I'm just going to take a wisp of this cotton. I want you to look straight at that wall again for me. I'm just going to open your eyes. This is not going to hurt. It might just be mildly discomforting. Okay. And then again on this side. Okay, very good. Very good. All right, now testing cranial nerve 11 is going to be the spinal accessory. Okay, so I want you to first shrug up against resistance here. Okay, and then I want you to turn your head against this hand, and then over here. So I'm looking at the strength of the trapezius and the sternocleidomastoid muscles. Okay, and then hypoglossal rather, the 12th cranial nerve. I want you to stick your tongue out and go side to side. Okay, and then straight again. Okay, so it is midline and no fasciculations. Okay, and that concludes our cranial nerve assessment. Okay, now I'm going to assess the deep tendon reflexes in your upper and lower extremities, okay? So I'll begin on your upper extremities. By looking here, biceps for muscle movement, and then leave it resting. Yes. I'll strike my thumb. Okay, I see a clear muscle contraction. And then here, triceps. Okay. And now down here for the brachioradialis. Okay, there it is. Okay, very good. You'll do the same thing on the other side. Okay, clear muscle contraction. Okay. All right. Now we're going to do the lower extremities. We're going to do the, if you can uncross your legs for me, okay? We're going to do the patellar, and then down to the Achilles. There we go. Over here. Very good. And the Achilles. Okay. Over here. Okay. And then what I'd like for you to do is straighten out just one leg at a time. Okay. I'm gonna bring this against the lateral aspect of the foot and up to the middle. Okay. What I'm looking for is a negative Babinski, which would be a downward fanning of the toes. Yes, just like that. I can see these toes. Okay. Upward would be a abnormal finding, usually only present in infants, babies up to 2 years of age. Okay, so that's normal. If you could just lay back for me, scoot back just a hair. Okay, that's good enough. Okay, and just kind of let this leg go loose for me. Elevate it slightly, but let the foot hang loose. Okay. I'm going to flex here, and I'm looking for clonus. Negative on the right. Same thing over here. Okay. Very good. You can sit back up. Okay, I'd like for you to close your eyes for me, and if you could uncross your legs. Okay. Place your hands just here to your side. I want you to tell me if you feel a light or a sharp sensation. Okay?
Light. Ooh, sharp. Sharp. Light. 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 Sharp. Sharp. Sharp.
Okay. Very good. Okay. Next thing I'd like for you to do is place your hands palm up for me. I want you to close your eyes. Okay. I'm going to place a couple of objects in your hand. I want you to tell me, just give me the best idea or general description of what you think they might be.
A coin.
Okay. Very good. Now what about this hand?
A bigger coin.
Okay. Very good. Very good. Correct. You get to keep those now because you did so well. Okay, keep your eyes closed for me. Okay. I want you to tell me what outline I'm forming in your hand. Let's try this instead.
An 8 or an infinity sign.
Okay. All right. Now let's try this hand.
One more time. A triangle.
Very good. Okay. Now, I'm going to take 2 points here, and I'm going to ask you to tell me when you can distinguish them as two. We can do it in just the one hand. Actually, tell me if this is 1 point or two, okay? Now?
2.
Now?
1. 1. 2.
Okay.
2. 1.
Okay, very good. So, just a couple of millimeters there. You lost the 2-point discrimination, meaning you identified it as one object, and that's a normal finding. Okay.
Okay.
Okay. The next thing I want you to do is close your eyes, put your arms straight out in front of you. Okay. Just keep them both at the same level for a few seconds. Very good. Very good. Okay. You can rest those. Now, what I'd like for you to do is look at me. You can open your eyes. Okay. With your left hand, touch my finger. And then touch your nose, finger, nose. Okay. Now over here with the right, finger, nose, faster, finger, nose, fast. Okay. Very good. Now keep your hands as they are, and I want you to do. I want you to pat your legs just like this, and then do the back side, and then alternate quickly, quickly. Okay. Very good. Very good. All right. Now, what I'd also like for you to do is, as you're in that seated position, I want you to take your left heel and begin right below the knee or as high as you can go with it. I want you to trace your shin all the way down with your heel. Right on the front of the shin, and then back up. Okay, let's also do it now with the right leg. And then back down. Very good. Now, if you could slide a little closer to the edge where your feet are flat on the floor, and with the right foot, I want you to tap your foot. Faster if you can. Okay. Let's do it with the left. Okay. Very good. Very good. You can stand now. Okay. The last thing we're going to do is a Romberg test. I want you to close your eyes and keep your hands to your side as they are. I'm just going to observe you for a few moments. Make sure there's no excessive swaying or imbalance. Okay. All right. And if you could take a couple steps backwards for me. Now. All right, what I want you to do is walk towards me a couple steps on your heels. Very good. Now on your toes. Okay, and then if you could start back in that back there where you were at before. All right, now what I want you to do is some heel to toe walking. First, I'd like for you to take a couple steps forward like that with your eyes open, heel to toes, just so you can kind of get the feel of it. Okay, and now I'd like for you to close your eyes and continue walking heel to toe. Very good. And then if you can, just turn around, walk away from me, just normally eyes open as you would normally walk. Okay, very good. That concludes our neurological assessment. I appreciate it.
Thank you.